Hello and welcome everyone. Thank you so much for joining JFNA's Center on Aging and Trauma for this special training webinar. It's so exciting to see everybody here. We had over 300 people registered for this webinar, and I'm really glad that we can be here to have this conversation. My name is Shelley Rude-Warnick. I'm the Managing Director of the Center on Aging and Trauma. And I'd like to begin by thanking the International Rescue Committee New Jersey office for coming up with the idea to have this training, because it's really hitting home with a lot of people, and we can see there's so much interest for us for this training. I'd like to now introduce my wonderful colleague, Leah Bergen-Miller, who's the Associate Director for the Center on Aging and Trauma, to begin our conversation about how aging and trauma are linked together, how this impacts refugees, and to introduce us to our wonderful colleagues and friends who do this work on the ground. Thank you very much. Leah?
Thanks, Shelley. My name is Leah Bergen-Miller, and as Shelley said, I work in the Jewish Federations of North America's Center on Aging and Trauma, and we are thrilled to be here today. This is really a marriage of my passions. As the granddaughter of Holocaust survivors, that propelled me to work in the field of refugee resettlement for about 15 years, until the past 5 years where I've been working with Holocaust survivors. And so when I was working for the Preferred Communities program as a case manager, I felt comfortable helping overqualified refugees obtain a survival job. I also felt like I was well prepared to get refugees who were pre-literate their first formal jobs. And I knew how to link single mothers to resources in the community. But the one thing that I was not really well versed on was how to help support older refugees. And I know that's a significant percentage of the population. One story that I remember is being in a hospital with a Rwandan refugee who woke up and she had medical devices tied to her, and she was in a chair, and it was like an IV drip. And it reminded her of when she was tied down from being raped. And she had told me the story of how everyone in her village had been raped, and how being tied down in this hospital bed really felt like that all over again. And I really wasn't prepared for how to respond to that. And so I'm hoping that through this webinar, we're going to learn some tips and tricks that will help better prepare you of how to better serve older refugees. So with that, I'd like to switch to the next slide, please. So what I'm hoping that you're going to learn from this webinar is first that you realize how trauma impacts the health and well-being of older adults, and specifically of older refugees. Also learn how to respond in a trauma-informed way. And hopefully you'll get inspired by hearing about successful programs of colleagues who work with refugees on a daily basis and how they are responding to older refugees who have experienced trauma. And lastly, this is most importantly, for you to think about how your work can be more person-centered and trauma-informed. Next slide, please. So here's the agenda for the meeting. I want you to know that this session is being recorded so that others who were unable to participate can listen to the recording later, and everyone who is registered will get a copy of the recording. Also, if you have questions, please type them in the QA box at the bottom of your screen on the right, or you can type them, that's really the best place to put them. We want this webinar to be interactive, so there's a couple questions throughout, and we hope that you'll chime in or type things back to us in the chat box as you have comments. Next slide, please. So with that, again, my name is Leah Bergen-Miller, and I also want to introduce my co-presenter, Charisse Jensen. She is the program manager at the County Care Transitions program in Salt Lake City. Salt Lake County Aging and Adult Services. And she's been with the program for 12 years and manages not only the caregiver support program, not only the refugee program for older adults, and not only the housing liaison program for older adults, also the Veteran District Home and Community-Based Services program. Charisse was an ombudsman advocating for the for older adults. And she's also worked in the field of education of emergency management in other countries. Next slide, please. So first of all, what organization do I work for? I work at the Jewish Federations of America, where we at the Center of Aging and Trauma, and our mission is to expand the nation's capacity to provide person-centered, trauma-informed services to Holocaust survivors, older adults with a history of trauma, and their family caregivers. And we do that through funding many different programs across the country that support these different populations, and training the aging service providers how to provide person-centered trauma-informed care to Holocaust survivors, older adults with a history of trauma, and their family caregivers. Next slide, please. So we have funded agencies in 21 states across the country over the past 5 years. And really, it's been hundreds and hundreds of programs that have been created through this grant. And you're going to hear about later how you will have an opportunity to apply for a grant if you're interested. This grant comes from the U.S. Department of Health and Human Services Administration on Community Living. And we're taking what we've learned from working with Holocaust survivors for the first 5 years to now applying these lessons to older adults with a history of trauma across the aging service network. So we're hoping to learn a lot from you in how you best serve refugees. Next slide. So first of all, there's a link between trauma and aging is really a key point. And so I didn't know that when I worked in resettlement because partially I was not a refugee. And part of what I thought was, for example, I was working with a lot of Somalis, and many of them hadn't been in war since, let's say, 1991 and had been living in refugee camps for 20, 25 years. And I felt like they had been through the trauma and now they were in the United States. And that was a big, big, big misunderstanding. There's a lot of people go through, again, a loss of control when they come here. And so we are now trailblazing efforts to inform the aging service providers that trauma must be considered. And then for you folks who are experts really in the field of trauma, to really remind you to take special care of the older adults with a history of trauma because it impacts them especially. Next slide, please. So first of all, to make sure that we're all working with the same definition of trauma, and I should say there is not one clear definition of trauma, but for the sake of this presentation, trauma is a result of an event. It could be something that happened quick and one time, like a natural disaster or a violent crime, or it can be an ongoing situation like domestic violence or war. And the circumstances present physical and emotional harm to the individual. And it has lasting adverse effects on both the individual's functioning and well-being. So it's important that the word here is individual because it really impacts every individual differently. So I'm curious, do you know the percentage of older adults in the United, or just adults in the United States who will be exposed to a traumatic event in their lifetimes? I encourage you to fill out this poll. It's either 10%, 26%, 90%, or 53%. Please go ahead and enter your results and press submit, and we'll soon share the answer. Okay, let's see what the results show. So, it's sort of split here. Most people thought that 53% of US adult population have had a history of trauma. I'm gonna surprise you and let you know that it's actually 90% of adults have experienced a history of trauma. 90%, that's really the majority of adults in the United States have been exposed to a traumatic event in their lifetime. Next slide, please. So, trauma and health are linked. It impacts you physically, mentally, and cognitively, has all of these impacts. So I'm curious, can you correctly select which health conditions are associated with trauma? Do you think it's gum disease, dementia, anxiety, or cardiovascular disease, or a selection thereof. You can choose more than one. All right, let's see what you thought. You can go ahead and press submit at the end. The answer is all of them. Yes, anxiety is a big one. You're right, but really all of them, even gum disease, trauma can impact. So some of the things I want to bring to your attention are gastrointestinal disorders or reproductive disorders, anxiety, depression, substance abuse, dementia, sleep disorders, cognitive impairments. It really impacts so many different aspects of your life. Trauma is associated also with risky behaviors, such as miscalculating risk or danger, like maybe a little bit more of an adrenaline junkie because it's hard to gauge what's really dangerous. And so maybe either tempted by it or avoidance or isolation or dependence. You'll also see substance abuse can be common in different ways, and risky health behaviors impact negative health incomes. Next slide, please. So some people who have experienced a traumatic event go on to develop post-traumatic stress disorder, PTSD. It's important to mention that not everyone who has experienced a traumatic event is clinically diagnosed with PTSD. And so this condition requires a clinical diagnosis. So I'm curious, do you know the percentage of US population that will experience PTSD in their lifetime? Do you think it's 2%, 8%, 25%, or 13%? Let's see what you think. Okay, press submit and let's see your results. You may be surprised that it's 8% of the US population. Oh, you all thought more. It's actually 8% of the US population that will be diagnosed with PTSD. I want you to take a note to notice that 46% of Holocaust survivors have experienced PTSD. And you're going to find this especially interesting that 30% of refugees in the United States have PTSD. So that means that they've been diagnosed. So one thing I want to bring to your attention is if 90% of older adults have a history of trauma, 8% have been of general population of the United States has been diagnosed with PTSD. It doesn't mean that the trauma impacts somebody. It has any less of a significant impact. It just means that they have had a clinical diagnosis. And again, not everybody who has experienced trauma will get a clinical diagnosis. Next slide, please. Can you take down the poll, Chance? Here are trauma effects on aging. So from our work, we've learned that trauma impacts individuals of all ages and effects evolve over time. It's not uncommon for symptoms of trauma to evolve after somebody hasn't had symptoms for a long time. It's also not uncommon for symptoms to emerge for the first time in adulthood after decades of having experience. And lastly, it's not uncommon for trauma to emerge in older adults to be more extreme than previously experienced. It could be that somebody has experienced trauma and they figure out that they just have to keep on going. Maybe they got persecuted and then there's a war and then they go to refugee camps and then they have to get resettled in the United States. It just keeps on going and something can just trigger and can unfold. And that could be anything. It could be the changes in familial roles, like maybe somebody was the matriarch or the patriarch of the family, and now they aren't working and their children are really become the breadwinners of the family. Or maybe a woman ends up leading the household because she makes the most money and that transforms the role for everybody else in the household. Or children end up translating for their parents and that can really change the dynamics of the household. Also beginning retirement, if somebody's purpose was their work, and I would say I'm guilty of this, that when they stop working, that can be a trigger for some people. Or the emergence of health problems, like if you can't see or you can't hear or things like that, Those can all be triggers. Next slide, please. And so what is a trauma trigger? So it's basically, many of you may be familiar that it can be a sound, a smell, a touch, a sight, a taste, a feeling, any circumstance that reminds you of the past trauma. And so it often leads to a fight, flight, or freeze moment. So it could be for Iraqi SIVs, it could be fireworks. For Holocaust survivors, it could be medical procedures since they've been tested, or it could be war. Can you all type in the chat box some of the populations you work with and what the triggers are for some of them? One example could be waiting in line for food could be a trigger. It reminds them of being in the refugee camp or something like that. Okay, next slide, please. Feel free to keep therapy dogs, thunderstorms. These are really great examples. So in the previous section, we highlighted the link between trauma, health, and aging. And in this section, I'm going to explain the approach that the center has developed to support older adults with a history of trauma and their family caregivers. So this is the response to these challenges. And next slide, please. So the response is person-centered, trauma-informed care. And I live in Washington, D.C., and so we always give an abbreviation for everything, which is PCTI. So you might hear me say PCTI instead of person-centered, trauma-informed care. So PCTI care is a holistic approach to delivery that promotes trust, dignity, strength, and empowerment of all individuals by incorporating the knowledge of trauma into agencies' programs, policies, and procedures. So for example, in terms of service delivery, maybe giving Ziploc bags. Oh, I'm loving these examples that you're providing. Keep them coming because we're going to learn a lot from these and incorporate them in future presentations. But as I was saying, Ziploc bags as an example, if people are afraid they're not going to have enough food and they start wrapping things up and not eating enough or else like really eating everything because they're used to being hungry, you could bring Ziploc bags after an event and people know that they can take the leftovers home. Another thing is for service delivery to make sure that you are supporting your staff through this time through secondary trauma and burnout. So think about what kind of support are you providing your staff? Or I know that a lot of the staff often lives in refugee communities or is socializing with refugees. And so how do you create the boundaries? How do you implement that when you're so part of the community is a huge challenge. Also the agency space. Do the pictures on the walls reflect the people who are walking into your agency? And finally, policies and procedures in terms of empowering all. Okay, so this is based off the SAMHSA model and of the 6 principles. I just want to bring to your to highlight the first is safety, and that really is psychological safety and also safe space. The other one that I really want to bring your attention to is trustworthiness. So if you're running late, to let your clients know you're running late. They've been used to like 1 minute can make all the difference in a refugee's life and from where they came from. And so now it's really important that you let them know you're still coming, you will be there, and how you're present. And then lastly, I would say empowerment, voice, and choice. Give your clients as many opportunities as they can possibly have to have choices in their life. Even if it's small choices, it at least empowers them and to feel like they can speak up. Next slide, please. So here's an example of how agency space can be trauma-informed and not trauma-informed. Again, in my beloved Washington, D.C., this used to be the sign. Can you imagine that if you had a sexually transmitted infection that you would want to go follow this, or to the detox clinic, that you want everyone to know what direction you're heading in? No, of course not. So just to be mindful of, it might be that as service providers, we think, well, that's where women's services are, that kind of thing, but to really be mindful of what it's like to experience that as somebody who's coming into your office. Like if here's the food pantry, like maybe of what it feels like to be asking for food. On the other hand, I went to an exhibit of showing like a historic event about Vietnam, and they warned people to because there was a lot of veterans who were going there, that you might experience triggers here, that this might remind you of a moment that you may not want to. And so just to be mindful. And so there's ways, like when you're showing a movie, if it's a violent movie, just to give a warning. Next slide, please. And so this is really to give you an idea of the kinds of programs that we've funded over the years. And really any program can be person-centered trauma informed. So I heard, for example, at Lutheran Social Services in Grand Rapids, that they had chair aerobics for older Burmese refugees. And this really helped to decrease isolation. Or for mental health, I heard of Russian refugees coming together for Russian tea time. It wasn't posed as mental health, it was posed as tea time, a chance to be social. Another example is in socialization, to have Congolese come together in drum circles. And that's something that people of many different abilities are able to participate in. So, and in terms of training, I want you to go ahead and add in the chat box if you have other ideas of how you, like, of certain programs that you've seen for older adults, for older refugees that have been really successful. So I'm mindful of the time, and I would like to take this opportunity, and I'm happy to answer more questions about our programs later, but to go ahead and introduce Charisse Jensen. She and I were Insta friends at a conference we attended because I was so impressed by the programming she had for the refugees that she's resettling in Utah, a gardening program. And she'll tell you all about many different programs that she's running. Charisse?
Leah, I'm really happy to be here, and what an opportunity this is. I do have to say, at the very beginning, when I did meet Leah at a conference a few years ago, she was doing a presentation on Holocaust survivors and person-centered care. And this was right when we were just starting our refugee program for older adults. And I'll explain it a little bit. I'll explain actually it a lot here in just a minute. But I just wanted to share that it was really an eye-opening experience for me, where I realized that we had all of these great services available, but those services were being provided from the outside in. And I realized that with this person-centered, trauma-informed care, that it needed to be also from the inside out. And I'll explain what that looks like here as I go along. But to start off with, a little bit about Utah. Utah, we are huge supporters and advocates for refugees, huge. And something that really separates us from a lot of other states is that we have a couple different resettlement agencies. And when refugees do come into the United States and come to Utah first, they are with a resettlement agency for 2 years. So during that time, they have the opportunity to get housing, to get their food situation figured out, work, kids in school, and all of that. But one of the areas that we realized that there was a lack was with the older adult refugees. We realized that once they were with these, with the resettlement agencies, there was kind of this gap. And on the aging services side where I am, we were getting a few refugees receiving some of our services, but there weren't very many. And with the type of populations we were working with, we realized that there was just this gap. And we needed to figure out how to make this connection with the refugees in our community, but also with the services that were offered, and knowing that we could offer some additional assistance. So we reached out to our state refugee services office, and we had a tremendous, it took a year for us to really collaborate, and we developed a program. They had some funding through ORR, so the Office of Refugee Resettlement, and they were able to provide with us some funding to help develop the refugee program for older adults. Okay, next slide. So the refugee program for older adults, really, it's a short-term program. It's for people, refugees who've been in the country for 2 to 5 years, who are over the age of 60. And there were certain requirements that specifically came from ORR, and I have them listed here on the slide. So access to senior community centers, nutrition services and meals delivered to homebound clients, transportation services, interpretation and translation, citizenship, home care, adult care, respite, elder abuse prevention, and nursing home ombudsman programs. Next slide. Okay, so if you see the ones that are highlighted in yellow, those are all the programs that already exist with aging services. And there are aging services all throughout the United States. And these are programs that are already developed and are already available to anyone, to refugees, to immigrants, to anyone. But we realized that there were a lot of gaps, and that the services that we had were really providing from the outside in. And we really needed to reach these refugees that we were coming in contact with, and reaching them in such a way that we were able to help meet their needs. So this kind of gives you an idea of the different types of services that we were asked to provide. But in addition to that, we were also asked to provide additional resources, classes to refugees, and they were available for refugees no matter how long they'd been in the country or how little they'd been in the country. They were available to all refugees. And but the most important thing that we really were tasked to do was to help prevent the social isolation. And this is something that we really saw a lot with the refugees we were working with, and just how isolated they were. And there were so many barriers already in place, and how to move past that and to really help connect with them. So I'm with Aging Services. I'm with our Salt Lake County Area Agency on Aging. So we're considered a AAA. And like I say, there are AAAs all throughout the United States that cover some part of where you are in the United States. Our particular AAA is just for Salt Lake County. There are other AAAs in Utah that maybe cover 5 or 6 different counties, but we have those services already in place. And the reason why I say that they are provided all throughout the United States is that these highlighted services are part of the Older Americans Act. So we're mandated. These are required services that we are, we need to provide. We do provide those. And one way that you can find access, if you're not familiar with your local AAA, is to go to eldercare.acl.gov and enter in your zip code, and it will show you the closest AAA to you, and that is and then connect with them. Now, even though these services are provided, they're mandated, we all provide our services a little bit differently, and but we do have these programs in place. So we have a caregiver support program. We have senior centers that are in the community. We have Meals on Wheels that deliver food to homebound seniors. We have transportation services to medical appointments. We have in-home services that provide care to clients. We provide ombudsman services for people who are in nursing homes, and we provide, let's see, oh, sorry, I can only see part of my screen. So nutrition, let's see, hold on a second here. Make sure I'm telling you right. Okay, and then we also have additional services on top of that. Okay, thank you. Okay, so I'll show you what we have done with these services, because even though we have these services and they're kind of looking on the outside in, how we really were able to connect our refugees with these particular programs, and examples of what we did. Many of the refugees that we are working with are still in survival mode. If their housing or their access to food is really being threatened, they are less likely to want to be engaged with our other programs. And we found that as we met, when we met them where they are, we were able to really connect better with them. So this picture here is of a woman. She is from, oh my gosh, where's she from? She's from Burundi. And I'll call her Miss N. Miss N was a lovely woman, but there was a great deal of trauma that she brought with her and her family. And there's a big trickle-down effect with the trauma she had experienced and that had passed down to her children and to the grandchildren. And there were lots of problems going on. And so we had a caseworker, a coordinator, a refugee coordinator that we had hired who really was focusing on the refugees. And she came across Miss N. And Miss N had been drinking a lot. She had been just really struggling. And so the coordinator had reached out to Miss N and said, come on, I want to take you to a senior center. And there's some programs there for you. We want to take you. And so they went, Miss N went with her. And even before they had walked in, Miss N said, I can't even go in here. This place is too beautiful for someone like me. This is not a place for me. And so the coordinator said, you know what, come on, we're just gonna go in, we're gonna make introductions. And the senior center manager was there and she had this big smile on her face. And she said, welcome, welcome, welcome.
Hi, it looks like Sharice's screen just froze. I appreciate your patience as we're working, many of us from home in different places. I think she's going to join us again shortly. Just a moment, please. Apologies for the technical difficulties. I think we're just waiting for Sharice to reconnect. Thank you for your flexibility. I encourage you to go ahead and type any questions you have in the QA box in the bottom right of your screen. And we will definitely get to answering them. And I've been glad to see your ideas in the chat box just for things for us to include in future presentations. But your questions in the QA box, we will be happy to answer them soon. You all are the most understanding crowd to have technical difficulties with, so thank you very much. I promise the ending will be worth it. If we don't hear from Sharice soon, we can maybe start answering some of the questions, and when Sharice joins us again, we can go back to her presentation. Shelley, are you there that you can that you want to start answering some of the questions until Sharice is able to join us, and then we can pause and go back to Sharice if that's all right with you?
Yes, sure. So I'm looking through some of the questions. Some of the earlier questions had to do with the diagnosis of PTSD. One question about whether that's diagnosed overseas or whether that's diagnosed here domestically. Another question about the disparity between the percentage of people who have a history of trauma versus the percent that get a PTSD diagnosis. Is that because of lack of awareness in service providers, or possibly not all people with a history of trauma get a PTSD diagnosis? Those were a couple of the questions that came up. One question was asked about the Elder Care Locator resource website. I replied to that in the Q&A with the link to that website, and I'm going to be looking up the link to the website for the AAAs as well. So Leah, do you have any sense of the PTSD answers?
Actually, if you could repeat, where does the 30% of refugees with PTSD figure come from? Yes, I'm happy to point you to our website. It is agingandtrauma.org, and you will find there some fact sheets. And it looks like, Charisse, are you back?
Can you hear me?
Yeah.
I can hear you, and we'll go ahead and we will pause our questions. Thank you to the audience for being so flexible. And Charisse, the floor is all yours.
Okay, I am so sorry. I do not know what happened there, and you can't see my face, but that's okay. It's like red. But anyway, okay. So
You're back.
all right. So what we've learned with our refugees and reaching out is that they want to have a sense of identity. They do not want to be identified as refugees, but as people who have had a life prior to coming to the United States, prior to the travesties that they have experienced. They want to be known as the farmers or the ranchers that they were, or whatever it was that they had done. They want to be known for that, not just as a refugee, because it takes additional identity away from them. Putting pictures on the walls and outreach materials. So many of our outreach materials at Aging Services had your average Caucasian elderly woman on the front. And we realized that we needed to change things up and really include where people could look at our outreach materials, as well as the pictures on the walls, and be able to identify themselves in that manner. Another thing was to explain expectations. When a refugee would come to our senior center, we would walk them through. We would walk them through the entire process from the time the bus would pick them up at their home and explain to them the traveling process, to look for landmarks, where to get off, how to walk into the senior center, how to check in, how to gather food, what was expected, where to put your dishes after everyone was done, and even where to be able to gather your items and how to get involved with classes. The next one is to provide cultural orientation. Not only were we doing a cultural orientation for our refugees, but we also were doing a cultural orientation for our staff, because that was important for them to learn these barriers as well and different things that were expected of them. And finally, to ask the refugees, where do you want to go? What are things that you want to do? And really go from that direction. It made a huge difference. Next slide. Okay, so I do need to wrap up. We're wrapping up on time here, but these are a few different experiences that we had over the last couple of years. We received a grant to get garden boxes, and as you can see, we have garden boxes here that the refugees were planting in, and they really loved it. It was a place for them to gather and talk, and it gave them a sense of purpose. On the far right-hand side, you can see where they're building. We had them help build these boxes and put them together, and they loved the opportunity. And honestly, for some of them, they learned how to drill, to hammer, to build things, and it was really great. We also did a sewing group, and as you can see in that middle picture, these are all aprons that they had sewn for themselves. I'm just going to wrap up here, but what I wanted to say, let's see, let's go to the next slide. Okay, let's go to the next slide. Okay, some of the trauma triggers that were experienced by the refugees. Obviously, animals are really a big area for refugees. It's a trigger for them. Loud noises, I think a lot of us are familiar with that. Some other things that I was really surprised with was not smiling. If there's a staff member who's not smiling or welcoming, that really is a huge deterrent for the refugees. Having them observe staff being impatient to others. We had a staff member who was really kind of rude to one of our volunteers who was helping the refugees and during a sewing activity. And I'll tell you what, the refugees totally cut that staff person out. They wouldn't talk to her, they wouldn't acknowledge her, because that was a trigger for them. And it was really interesting to see this occur. Okay, next slide. Advice to you, to various resettlement agencies. One, to develop a relationship with your AAA. Even though there might not be a vision on their end for what a collaboration can look like with the refugee program or having additional services to refugees, it is possible. We are making, and I'm sorry for the lack of time without explaining more in detail, but there are services that are available. And I am happy to help advocate for you if that is something that you are interested in. I'm happy to talk with the AAA, the AAA about our possible vision and services that we have been able to already provide for our refugees. Develop that relationship with the senior centers, super important. You can make referrals for your clients to go to the senior centers right now. Provide opportunities for the refugees to be able to give back. With the sewing program, they were able to provide they were able to sew different items for people at the for our Children's Hospital, for the cancer, we have a cancer hospital here as well, and they loved it. And it really made them feel like they had an opportunity to give back just like people have given to them. And then connect people with multiple programs. This is really important because if one happens to go away, or maybe there's a pandemic, it can really alter services. So having multiple programs that they are involved with can help continue to help support the services that they need. All right, and next slide. Okay, Leah, I'm going to turn the time over to you.
Cherise, thank you so much for the presentation. And I'm so impressed that you're able to pull it together. I just wanted to give you one opportunity really quickly. One of my favorite programs that you've done was the blankets and donating them to hospitals. I was wondering if you could give a 1-minute summary of that program, because I think it really goes to show that refugees want to give as well and want to have a purpose.
Yes, so they did make blankets for the Children's Hospital, for the primary Children's Hospital here. And that was actually an idea from the volunteers. And they went to the refugees for the sewing group that we had, and they were so excited. And one of the comments that the refugees had said was, I am so excited to be able to give back. We have been given so much. We want to be able to give back. And it was just huge. And they loved it and loved being able to hand those blankets out. We did take them to the hospital where they dropped them off. And it was really a beautiful experience.
Thank you for sharing that. And Cherise has so many other ideas. So we encourage you to follow up with us later, and we're happy to get you in touch. I'd like to go ahead and bring it back to Shelley, who is going to moderate the QA part of this. Shelley?
Sure, thank you. I've seen quite a few questions coming in the question and answer section. If you have more questions, please type them there in question and answer rather than in the chat. And just as a resource, if you look on the website agingandtrauma.org, you'll be able to find many fact sheets on aging and trauma, including fact sheets that have some of the statistics that you've seen, as well as a resource library and bibliography of other resources on aging and trauma. So you can actually read some of the source literature, and all of that is up there on the website. And to answer some of the other questions that came about, people were asking about senior centers and AAAs. AAA stands for Area Agency on Aging, often thought of as the company that helps with cars. I think I forgot what it's called, American Auto something. It's not that AAA, it's the Area Agency on Aging. And there's actually an association of all of the area agencies on aging, and they provide other resources and funding, and they do a lot of advocacy work as well to get more funds for the Older Americans Act. And I put the website of that association in the chat as well. It's called N4A, National Association of Area Agencies on Aging. So feel free to go to those places. Some other questions that came in the chat. Do you have any, is there any research on outcomes of efforts to improve access to mainstream aging services versus specific services for older refugees?
Charisse, do you have any information on this? I haven't seen any studies on this. I think that the two worlds often operate independently, and we're really trying to bring them together here.
So there is not really a lot right now of research, and I did do a small study of, we had a refugee garden at one of our senior centers, and we recorded how the refugees felt before and then after the gardening project, and you know, did it help them feel more integrated with the senior centers? Did it help them feel less depression and different things like that? And really overall, it did help. These types of activities definitely do help. But along with that too, we found is that there does need to be additional support on the senior center side to engage the interaction of the mainstream participants and the refugee participants to integrate more of that. So there needs to be some sort of an outside group person to help with that integration better.
Thank you, Charisse.
Can you give any examples or tips on how you've been able to adapt programs in the COVID-19 environment, how to build relationships with older adults while many staff is working from home, and how to do this safely during the pandemic?
I can give a couple that I've seen from Holocaust survivor programs. So some of what I've seen is to really call the older adults on a regular basis. Another thing is to send care packages to handwritten letters to let people know that you're thinking about them. I've also seen programs go online, and I realize this can be challenging to even have, sometimes not Zoom, but to do conference calls has been useful as another way of getting people to join together. Charisse, are there other ideas that you've seen of how to continue the connections in this pandemic world?
Yes. So I'll be honest. Our person who we had a perfect storm. So we had, just before the pandemic hit, our coordinator had quit, moved on to a different position, and we had a hiring freeze. So we did not have active involvement with this program for the good part of the pandemic, which was really hard. And it made us realize that we needed to do more on our end. And so one of the areas that we are really helping to support this population is reaching out and finding volunteers and developing a volunteer program to support our older adult refugees in the community, and to make those phone calls and to help connect them with like, we have our virtual senior centers, so to help connect them with those and other areas of where they can connect with each other online.
And related to volunteers, how have you adapted senior companion programs for volunteers that are American English speaking? How does that work with refugees who do not speak English?
That's a really good question. So we have a couple different things. We have integrated our senior companion program. This is tough because there's a lot of things going through my mind right now. So the English, we do have a lot of refugees who do speak English and are open to having the senior companion program, having a senior companion come in. Another area that we are looking at that we are working toward is developing training for senior companions in their own language and providing a senior companion from a specific refugee community be available to those participants of that particular community. Does that make sense? So they would be reaching out, they would be connecting with people in their own language, in their own community through the Senior Companion Program. We started working toward that. We're going to be moving further with that. We just need that additional support on our end to be able to move forward with that. But we have all of the information translated in various languages already, so.
We've had a couple of requests for you to finish the story about Ms. N. Is there a conclusion to the story?
There is. Okay, sorry. I don't know where I left off or where it left off. I'm so sorry. Okay, so Miss N. So did you guys hear the part about with the gardening and all of that, where we showed the garden? Did you hear that part?
I think it left off where she entered the senior center.
Oh gosh, okay. So she went into the senior center and the whole time she's just like, this is not for me. And it was realized that Miss N had been born in servitude. She had been a servant her entire life, and that's all she knew. And so she didn't feel comfortable in there. She felt like she should serve the people rather than be a participant. In fact, she had even asked if she could maybe wipe down some counters or some tables there so she felt like she was part of that community. And we told her, no, you can't do that. This is for you, not for you to serve. So she still felt uncomfortable. The senior center manager walked her through and took her to different areas. And finally they went outside and there were some garden boxes and they hadn't been used for years. And they were full of weeds and they were just kind of messy. And the senior center manager apologetically said, I'm really sorry it's such a mess, but these are available for you too. And at that moment, Miss N made a connection. This was for her. And she had just started to cry and said, thank you, thank you. She knew very little English. And then the senior center manager said, oh, and turned around and there was a whole space up against the fence that hadn't been used forever. And she said, and this is for you as well. And you would have thought that it was Christmas morning. It was amazing. And so anyway, Miss N started going to the senior center every day. She had her daughter come with her to help as her caregiver. And they went and they brought their tools, they planted, and she went every day. And pretty soon she started to go by herself. And then she started to make friends at the center. And those friends started to ask her to come sit and eat with them during mealtime. They have a congregate meal there. And she had friends. She had people who would say hello to her. She had people that she could gather with. None of them spoke the language that Miss N spoke, but they were welcoming, they were warm, and they all spoke this language of love. And it was amazing. It was beautiful. And it really made her happy. And she had this amazing garden going on in the back of that senior center.
Thank you very much. We don't have any more time for questions, and unfortunately we have to wrap up now, but we're happy to get all of the participants connected. If you have additional questions, feel free to email aging@jewishfederations.org. And again, that's aging@jewishfederations, plural.org. And we will be happy to continue to get information to you if you have other questions. Leah, back to you.
Thanks, Shelley. So as follow-up, we are going to send a questionnaire to get feedback on this webinar of how we can improve it in the future. I also want to let you know that we are going to be issuing an RFP come spring 2021, and you will have the opportunity to apply for one of our grants to help the older refugees in your community in a person-centered, trauma-informed way. Also, write us to learn more about future webinars and collaboration opportunities. And we will be also distributing a national survey on person-centered trauma-informed care. And like I said, we had a grant 5 years ago and we just got a new grant. And so we're going to be measuring the success of this grant. So we'd love to get see what the knowledge is of people now. And then we're going to ask for it again in 5 years to see the impact of our program, if hopefully we get funding for the next 5 years. And lastly, I give you the assignment that while it's fresh in your brain, to write down on a piece of paper 3 ways that you can make your practice more trauma informed. And if you want to incorporate PCTI care into your meetings, next slide, please. I encourage you to check out these resources that we have. You can discuss them in staff meetings, like a quick article or so forth to read. Here's just a couple of sources on person-centered trauma-informed care. Next slide, please. Also, if you have questions, feel free, like Shelley said, to write us at aging@jewishfederations.org. And we also encourage you to look at our website, and the fact sheets on that website are brand new. And they're 2 pages long. So if you had a colleague that you wanted to get the takeaways from this and didn't have time to watch this, we encourage you to print out those fact sheets and drop them off with them or forward them electronically. So with that, thank you all very, very much for participating. It was a pleasure speaking with you today, and we hope to hear from you more. And we hope to get your grant applications come this spring. Take care. And we will also send slides after this webinar.